Hi, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist. I work in UK, and with me for this interview is Dr. Prasant Ampalam, and he is an IMG doctor from India, an IMG psychiatrist who completed his MD in psychiatry from India, and then he came to UK in 2022. And this interview I have requested him because, especially because this was for the CESR, because Dr. Palam has actually finished his CESR and now is on the GMC specialist register for psychiatry. And I think this is a question a lot of IMG psychiatrists ask us, that, I want to come to UK and work. Do I need to go through training again? And can my training be counted again in UK? Or how can I become a consultant? So I think this is a very good example to understand the CSER pathway and how Dr. Palam has done that. So first of all, thank you very much for joining me, Prasant. This is I'm really glad to have you on this forum.
Yeah, thanks, Raja. Thanks for taking time and inviting me to do this. Yeah.
Can you just tell us a bit more about your background so people who are watching the IMD psychiatrist they can relate a bit more then?
Yeah. So I did my MBBS in India, and then I did my post-graduation MD Psychiatry in India. After that, I started my private practice. So worked as a consultant for nearly 7 years after my MD in India, and then in 2020 I moved to UK. So I have done my MRCPsych in 2018. So though I have done my membership exams, so I didn't move to UK because I was doing really well in India at that time. So for various reasons, I made up my mind and then started exploring jobs and moved to UK in 2020 and started as an acting consultant directly. So, I mean, in IMG Group, we see people asking whether you can directly start as a consultant.
Yeah.
I mean, there are various difference of opinions, but for me, it was good. I had a good shadowing consultant, and then I started directly as locum consultant in 2020, and then I made sure that trust is aware of my future plans about CSER. So I have submitted CSER application in 18 months, and then because of COVID and for other reasons, it was shelved at GMC for considerable time.
Mm.
But nevertheless, application got approved at one first go itself. They haven't asked me to review it. So they have me now on specialty register of GMC for general psychiatry.
And I think for IMGs to understand, so there is two different pathways to get on the GMC specialist register. The first one is to actually go through the training pathway. So first you like the British graduates, you do core training in psychiatry, then you do ST training in psychiatry, and then you go on the specialist register by doing CCT after completing ST training in psychiatry. Or if you come from outside, if you can have done MD or FCPS from Pakistan, and then you come to UK, you have passed your MRCPsych, you can go on your ST training, and then again, you can get CCT and get on a specialist register. But then there's a third pathway, which is like that you can actually consider doing CSER, which means that you haven't done any formal training in UK, but you've gone through the process of applying for CSER and gathering evidence for that. So this is, can you tell us a bit more about Caesar? That
Yeah.
how did that came to your mind and how did you plan it?
So initially, I thought of joining ST4 because I have MRC Psych, and if I
Yeah.
just get the certificate C, I can join ST4 and then get CCT after 3 years of training, like you mentioned. But again, not for everyone. That's what I felt because of family reasons. I cannot roam around different hospitals and different areas during training. So I thought I would consider CSER pathway. So the first thing that what I have done is I have gone through GMC website. There is a good material to read about, to understand about CSER curriculum. It varies from specialty to specialty.
Mm.
Psychiatry, I mean, all the specialties have their own CSER curriculum. In psychiatry also, they offer CSER in general psychiatry, child and adolescent, OPMH, so different subspecialties. So you need to understand what is expected. So obviously there are certain things that you have to get trained here.
Mm.
For example, psychotherapy. Most of the times, IMGs like us do not have a formal psychotherapy training as part of our MDs, our psychiatric training in India or Pakistan. So they are very specific about the psychotherapy training. So which I have got here. So I have done like 2 psychotherapy cases with a proper psychotherapy supervisor, and then the legal work. again, which forms a big chunk. So you have to understand the Mental Health Act and the sections, and you have to do that. You have to do the tribunal reports and then attend tribunals. So put up that legal work. So for me, the idea of CESR is like, even before moving to UK, I'm very sure that I don't want to continue training for family reasons, and then I want to pursue CESR. So yeah.
I think that's very good to say that, because sometimes people ask, then can they directly apply for Caesar from India or Pakistan when they're outside? They say we have 10 years experience in working in my country, and if there's a specialist register, can I directly go on that? But you have explained that, there are certain competencies you have to achieve, and especially the legal framework, the Mental Health Act, the Mental Capacity Act, and those things to understand them before they can let you on the specialist register. But how did you plan it? So once you got this idea in your mind that that you are not pursuing the training pathway and you're going to pursue the Caesar pathway, what did you do? I mean, I'm sure you are a very organized person, to actually achieve that in such a small amount of time.
So I think what's the most important thing is like, you should have your own vision when you want to achieve and set the targets, and then you should be able to negotiate the support from the trust. I think that's where, like, most of my colleagues, because if you take my trust, like where I work, there is only one successful candidate in last 20 years.
Mm,
So I'm the second one. So many people started but then left in between. So so I think what I have done is, I was very sure of Caesar doing Caesar. So I made it clear to my line manager in CD at that time that my SPA time, I will be
mm,
exclusively using it for my Caesar.
mm.
So I have 2.5 SPA time, so every week. So I said want to use that time exclusively for my Caesar. Yes, I will be available for my routine clinical job over phone, but I will be doing the necessary rotations, and I'll be roaming around psychotherapy clinics or inpatient, because I work in a community. So I said I'll be going to inpatient and psychotherapy units to gather the necessary evidence. So, and then once it is incorporated into the job plan, I think it makes things easier.
Mm. So I think SPA, I
So
just
I think
wanted
that,
to say, sorry, sorry, you can
so
continue.
go on. Yeah.
No, I just wanted to
No, no, I was
clarify
just
to
saying,
the IMGs, the SPA time you mentioned. So SPA is basically, just to explain a bit more, that when you have given a job plan, so you have 10 sessions. 10 session, half session is a day. So 10 session means you're working 5 days a week. And then in that 10 session, you can have seven direct clinical care sessions and three SPAs. And when you are not actually directly giving clinical care to the patients, but you are doing something to improve yourself and to actually doing other aspects of the service. Sorry, continue. I just wanted to clarify that because some IMGs might find it a bit confusing.
yeah, thanks, Roger. That's helpful. Yeah, so that's what I would advise any of my like colleagues as well who started Caesar. So try to incorporate, in your job plan what you wanted to do during the SPA time. So that you'll have that. I mean, many times what happens is people say that you'll have SPA time, but we end up doing the admin work or some
Mm.
other clinical work. So it's about initially, negotiating with your CD when you start the job. So I
Mm.
think that's really important.
And in terms of Caesar itself, practically, you mentioned psychotherapy experience that, because our ST trainees and our core trainees do have psychotherapy experience. Core training do at least two cases, one long case, one short case. They probably were asking to do the same for Caesar. But what else is required in terms of gathering evidence? That what were the things you were actually gathering when you were trying to prove that your application is strong enough?
So it differs if you have MRCpsych and if you do not have MRCpsych. If one applicant is having MRCpsych, that actually rules out the core training competencies.
Mm,
So you need not like submit the core training CT competencies if you have MRCpsych. So essentially, it matches the HLOs, the learning outcomes of ST training, exactly the same learning outcomes. So when you submit the CSR application, you'll submit in different folders. So if I just go along those folders, obviously you require first the CV, and
mm,
then your job experience, working experience, in the last 5-10 years, and then your qualifications they would ask, and then coming to the evidence, it's always, they call it as the primary evidence, which is the most crucial part. So primary evidence includes your clinic letters, your actual clinic work, So they would advise few referral letters, few clinic letters. For example, in psychiatry, take I have submitted like 30 clinic letters in community, and then a few referral letters, and then they would expect you to submit lots of legal work as well. For example, I have submitted around 5 tribunals in community and 8 in inpatient, very detailed tribunal reports, and along with that some additional legal work they would expect,
Mm.
which include MOJ, that is Ministry of Justice reports, and then few mental health act assessments, and then guardianship, various other bits of mental health act, and then psychotherapy, and then teaching research. So for teaching, you can show that, if you have taught any juniors, always take a feedback form and you can submit the evidence for teaching.
Mm.
And then your appraisals, they are really important again. And then WPBAs, workplace based assessments,
Yeah.
and appraisals. And research, for research they are not that specific. You don't need to have research publications, but if you can show them that you can critically appraise a published article, that's more than enough. So
Yeah.
you need to like submit that. And the other chunk that I think we cannot submit from overseas is management and leadership experience. So chairing meetings, chairing safeguarding meetings, strategy meetings, or doing a quality improvement project and
Mm.
showing that your leadership and managerial skills. So they would see into that. So I think these are the main bits.
Mm.
Yes, they also require something like referential statements and other stuff, but which can be done easily.
Mm.
But these are the main bits.
I think just to for the for IMGs to clarify for the IMGs, some of the terms you mentioned, you were talking about the tribunal report. So if you haven't worked in UK, you might not know that if a patient has been sectioned, which means they have been admitted to a ward against their will, the patient can challenge that section. I'm just giving you an example of what is a tribunal report. So if a patient has challenged their section, then it will be a tribunal. A tribunal will be independent from the hospital, and they will come and assess first the second doctor, independent doctor, assess the patient, and then you will have to go in front of the tribunal and tell them that why do you think the patient needs to be on section. And for that, you have to do some reports. I think this is what you were mentioning, that when you need tribunal reports, it means that they are directly linked to the Mental Health Act and how things work when you are treating patients on the Mental Health Act in the UK. Then I think the rest of the things you mentioned, as you said very clearly, that similar things what our ST trainees are doing, like critical appraisal. Not everybody is actively involved with research, but they are have the ability to critically appraise the research, and we do journal club presentations. And that is something which is common in UK. Then audits and quality improvement work. This is again something that people are used to. So one question people will always ask you, I'm sure you have already been asked that, if they say I am working right now in India or Pakistan, what can I do now which will help me in the Caesar? So what kind of evidence I should be gathering, or what sort of things I should be doing now if I'm aiming for Caesar in the future?
Right. One is obviously MRC Psych. Having MRC Psych would definitely make it easier.
Yeah,
Otherwise, you need to prove competencies for core training as well, which is
yeah,
I felt was more difficult because, for example, if you psychiatry, even if you apply in general psychiatry, if you do not have MRC Psych, you need to produce evidence from CAMS and other specialties as well.
yeah.
That is one thing. And I mean, maybe a bit of teaching experience, that you can, the evidence that you can get it from overseas, from India or Pakistan, wherever it is, the teaching experience that can be shown. um, Other than that, I would say, if you plan properly, good 18 months of work in UK is more than adequate to gather all the evidence.
Hmm.
Because
Re-
I mean,
research
what
done outside UK, would that be useful if they have done research in India?
Certainly, yeah, yeah. Because I mean, I have submitted some of the research articles that I have published in India. So yes, yeah. Again, it all comes under secondary evidence, Raja. Like the primary evidence is the clinical letters.
Hmm.
That is the primary evidence. The WPBA's research and everything falls under secondary evidence. So
So they are assessing you on your clinical work. So basically, by clinical letters, you mean you are actually the clinical letters. You see the patients, and then in the outpatient clinic, and write a letter to the GP. You submit
yeah,
them, and then you also submit, as you said, the tribunal reports and all of those things as well. And referral, when you're making referrals to a different specialty from psychiatry to, for example, medicine or neurosurgery or something like that, then those sort of things.
Yeah.
Um, and I would say people will always ask you another common question, that what are the hurdles, So once you've gone through the process now, and one thing you already mentioned, because sometimes GMC, it's not your fault that you have submitted everything, but GMC doesn't have time to look at it, and that happened in your case as well. But what are the practical hurdles that you think IMG doctor, IMG psychiatrist like yourself working in UK would face?
Yeah, I mean, we can see that in different stages, I would say. Like, while collecting the evidence itself, it's not that easy. Going to a different job, I would say, like, for example, I work in community, so but you need inpatient evidence as well. So also, again, it's a bit difficult sometimes. You need to go to different ward, develop rapport again, and then collect evidence there. So those are certain practical difficulties, and most of them struggle with psychotherapy
Mm,
because it is not well supported by trusts.
yeah.
They struggle to find supervisors, and
Mm,
you require a supervisor report. It's not like simple, if they do, let's say, SAPE or something, like, like an assessment tool. Even if they submit, that's not enough.
yeah.
They require a proper supervisor report, and most of us struggle to get that
Mm,
unless you are very well supported by trust. That's while doing CESR. And the other hurdles are, it is a time consuming process, I should say. Like, most of the people do take 3 years to collect the evidence, and
mm,
then there is a waiting time with GMC for them to. I mean, what happens is, once you submit the application, they would allocate you an advisor, a
yeah.
personal advisor. That itself take few months,
Mm,
and then the advisor basically does the checklist job, and they'll review your application, and they'll give you some suggestions, and you need to go back to them, submit everything, whatever they ask. So that takes around under 3 months, so it takes about 6 months. Then it will be passed to Royal College.
mm,
In my case, it went on to the waiting list for the submission to Royal College because there were no assessors at that
yeah.
time. So once the Royal College sees, and they'll come back to you if it is really good, and then they do not see anything, they'll come back to you and award you Caesar. If
Okay.
not, they'll ask you to submit evidence. I think this is where there'll be a major hurdle,
Mm,
because again, you have to start from the scratch.
mm,
So whatever the competencies that you have to resubmit, you have to do them, and then again it has to go through GMC, and they do the checklist work, and then again they'll pass to Royal College. So that takes another 6 to 9 months at least.
okay.
So I think you have to prepare yourself that it's going to be a long journey. So it may take 3 years, or it may take more than that.
Mm.
So
So
yeah.
thing you mentioned about, so you said it's very important to actually submit the documents first time rightly. Otherwise, if you are missing things, then it will bounce back to you. And
Yeah.
psychotherapy you mentioned again, I think this is important for us to just see what it psychotherapy experience means. But what our core trainees or what trainees in UK do, that when they are doing a psychotherapy case, it's not just about giving psychotherapy to a patient. It's about giving psychotherapy, doing psychotherapy practically, and then having a supervisor who you are actually also seeing regularly, weekly or fortnightly, and actually getting supervision from them, talking to them that what is happening in psychotherapy, and then feeding back. And then finally you finish the psychotherapy, and then your supervisor can write you a report. So have you done similar something? This is what you
Yeah.
meant?
Yes, Raj. I mean, it's a bit different for Caesar. For core training, I think you do one long case and short case, isn't
Yeah.
it?
Yeah.
Whereas for Caesar, the expectation is two cases. The two short cases is
Okay.
fine. It need not be a long case, but
Nice.
any form of therapy. But I mean, for example, I have done CBT, PTSD protocol,
Yeah.
and then I have another one. I have done interpersonal therapy.
Okay.
So I have done 20 sessions of CBT, and
Mm,
then 16 sessions of IPT.
mm,
So for each session, exactly like you mentioned, after each session, I had supervision
mm,
and supervision notes. And at the end of the session, again, supervisor notes.
mm.
And I have to write summary of each session, and also
Yeah.
the welcome letter, including formulation, and the end letter, therapy summary as well.
Yeah. So it's a lot of work, yeah. I think one other thing I wanted to ask you. You have mentioned already that for Caesar, it is important that you are working in a trust which is supportive. Then also that you actually negotiate a job plan which is also supportive as well. But what is the role of supervisors? Where the consultants who are working with you, are they also writing reports for you? other than practically helping you go through or get all the evidence, is there a report for a consultant, senior consultant as well, who's attached with you?
Yeah, so there are two things. One is they ask about a verifier. So
Yeah.
whatever evidence, documentary evidence that you submit, everything has to be verified by one of the consultant. Usually it will be a line manager
Mm.
or a supervisor, usually the line manager. So essentially you have to submit all the documents to your line manager, and then they would sign a document, a verified document, in
Yeah.
which obviously you'll get it from GMC, and then
Yeah.
you have to submit it. That is a role of line manager. Along with that, you require 5 supporting statements from different consultants.
Mm.
One has to be a medical director, one has to be a clinical director, and then 3 other consultant colleagues. So they have to, like, more like a references, a good reference.
Yeah.
So they have to write briefly about you, your work experience and everything. So yeah, you require 5 such letters from consultants.
And you've also mentioned something called WPA, WPBA,
PBA.
workplace-based assessment. Basically, I think the UK trainees will be used to that because this is basically the assessments we do during our training, and there are different types. There are some short cases, what we call mini ACE, then we have ACE, CBDs. But in your case, were you actually using Royal College of Psychiatrists portfolio to actually record these, or was it a different sort of system you're recording them on?
So I used both. I used, like, for case-based discussions, I used, I mean, when I first started, I used Royal College portfolio. So I have sent it to one of the consultant, the link, and then he has done it. But after that, I have started using a standard format that is available, for case-based discussions. It's not
Hmm.
in Royal College. It's a standard form that I got from Google, and then which I have used. And whenever I present, so I presented a journal club. So I presented a lecture. I used to give it to the other consultants. They used to fill it back and give it to me. And even the peer groups also. In the peer group meetings also, whenever I discuss a case, they used to do the CBD form, case-based discussion
Hmm.
form to me. So yeah.
So I mean, to just for the I'm just to clarify, the workplace-based assessment is basically you are doing an assessment, for example, or talking about a case with your senior, and they're signing you off, thinking that giving you feedback basically of how you did. Have you got any general advice for people who are thinking about? I think one question. Let me ask you, Vesa, which will I'm sure people will ask you 100,000 times is Caesar better or training is better? I think you already answered that. Is that this is individual circumstances, but is there a standard answer, or is there something that you?
I would say, Raj, I mean, I would say, if you think you can go through training, I
Yeah,
always say training, because it's more structured.
yeah,
Caesar is stressful. Just to put it straight, it is stressful because you will do your regular job. Along
yeah,
with that, you will do the training, bits of training as well. So if you think you can do the training and then your circumstances permit, I always say that, go for training. And but you think that, you already had enough experience, you don't want to go through the training, or for family reasons you want to stay at one place, and I think, Caesar is a way to go.
yeah. I think that's what I also advise. So in training, as you said, it's not just about that doing job, but sometimes you have to move between jobs. And as an ST trainee, you just don't move between the hospital. Sometimes you're moving between the trust as well. So like, you know, sometimes you are actually moving 30 miles from the first job to another job. So if you have a family and family commitments, so moving every year, it becomes a bit more difficult, as you said, and that is a consideration. But otherwise, as you said, trainees is structured, and you sometimes can see the end. So if I start ST3 or ST4, sorry, so I know ST6 is the end. So 3 years I'll have CCT. But in Caesar, it's just all depends on you and your supervisors, and also when you submit the application, the assessors. It can take a bit longer actually. I think that's what my advice is also as well.
Yeah, I
So
think so,
yeah,
Rajesh. I think it also matters, like, at what position you start as
yeah,
well in UK. For me, I think, because I started at really, a good salary and a good position in UK directly as a consultant, capacity. I think, I don't want to again go back to the training, because
yeah,
I'm already getting what I will get after season.
yeah,
You know what I mean? So the same
yeah.
sort of job plan, job role, and salary. So that, I think that's what kept me, trying for Caesar.
Mm.
So yeah.
Okay, just the last question. Have you got any general advice for people who are IMGs, especially psychiatrists, because we are both psychiatrists, and who are working abroad, who are thinking to come to UK? Is there any general advice you will get to give? Because you can now compare because you've worked in two different countries, and I didn't have actually luxury. I actually haven't worked as a psychiatrist in Pakistan. All my training was here. But would you give any advice to them? Should they come here or not? Is it worth it? People will ask you directly that.
Yeah, I mean, f- again, it's a difficult one, Raja. For me, I think people discouraged me because I had my a very good setup of private practice. To be honest, like I used to earn the same, like what I'm earning now. I used to earn the same, maybe save a bit more. To be
Yeah,
honest, in India, because I was also working as an associate professor in a medical college when I moved here.
yeah,
So pretty settled life. My wife also used to have a very stable job, but I think there are goods and bads everywhere here and then. It's ultimately to the what you prefer. But for me, I think after 3 years of psychiatry experience in UK and 10 years in India, I feel sometimes I do miss the private clinical practice in India. So I cannot say a straightforward answer. Sorry about it, but yeah, I mean, if you have a very well settled practice, income, and life overseas, I would say, unless you really want to try something different,
yeah.
and then stay where you are.
You know, I think that's a very important point. I think it's about the fact that you've gone through struggles here as well. So once you are settled, like same people will say to me that, I have done FCPS or MD in India, and I'm already working as a consultant. I have a private practice, or I can save money. My parents are with me as well. But coming to UK, uh, for them, they have to take a step back. Sometimes, as you said, even if they're not taking training, even working as a locum consultant, they also feel that this is still a step back. I'm still going to learn new things. I will still be under supervision. I won't have the same independence that I will have here. So have first 2 or 3 years to have that struggle. People need to just know that sometimes this is the price you're paying to come here, and then finally you will become a consultant as well. Finally you will have what a senior psychiatrist here as well, but there would be a time period of adjustment.
Yeah, that's true.
So thank you very much for joining and giving all the sharing all the experience and giving all the good advice. I think a lot of people will be very happy to actually hear this and see you and get the inspiration that they can also take this route and they can also do the Caesar, and think this will be very helpful for a lot of psychiatrists.
Yeah. Thanks, Raja. Yeah. Thanks for doing this. Yeah.